everybody, this is Rosalind, Diabetes College, Let's Diabetes It. On this episode today, we're going to do more about managing our insulin injection. So today we are going to begin to address the best way to go about managing our blood sugar control effectively by way of good insulin administration. You might be surprised how very little things we consider very little, will contribute a lot towards messing up our blood sugar control. So let's get going. Before we proceed with this demonstration, we are going to do some housekeeping. Okay, things you need to always take into consideration if you're a healthcare provider giving insulin injection or you're the person taking insulin for yourself. First thing to do is make sure you test your blood sugar just to know what your blood sugar is saying, and know that will be a guide as to amount of insulin injection you're going to give yourself. If it's low, you need to treat the low blood sugar. If it's high, and with the collaboration with your healthcare provider, they always tell you what to do if it's a bit on the high side. And you also probably look at the food you're going to eat to know how much insulin I'm going to take for this food. Some healthcare providers already work this out for some people. Some others are really quite competent in being able to determine the amount of insulin for a particular food, or being able to know how much to do insulin to give if blood sugar is a bit on the high side. These are different levels of expertise, and in this program we will continue to address a lot of things regarding those. So number one, you will need to wash your hand, make sure everything is handy, and then you test your blood sugar to determine how much insulin you're going to take for your food. So you get your insulin, your needle, your Sharps container, you get everything together and get ready. You determine the site you're going to give this injection, always being conscious of rotation. For the most part, what I'm going to do today, I'm going to go by guideline of the Fit Canada, the called Forum for Injection Technique. Fit Canada, they do recommend that the needle size we are going to use should be between 4 and 6 millimeters. Fit Canada pointed out that for everybody, skin thickness is almost the same, irrespective of your race, your gender, your height, your BMI, your weight, your color. Typical skin thickness range between 1.6 millimeters to 2.4 millimeters. And so the smallest size needle we can use, this is for adults, and so the smallest size needle we can use is 4 millimeter needle. With that, you do not need to pinch your skin. You just give yourself injection. 4 millimeters will nicely get into your subcutaneous tissue where we want the injection. 5 millimeters, 6 millimeters as well. But if you are using needle more than that, like 8 millimeters, you will probably need to pinch your skin and go at a 90 degrees angle. At the moment, 12 millimeters is no longer recommended. However, I do recognize that all over the world, it's not everybody that is actually using pen. There are people who still use insulin syringe or needle. So such people, you can't afford to say it's no longer recommended. In that case, you will need to pinch your skin. You can need to pinch nicely and go at a 90 degrees angle, or you pinch and go at a 45 degrees angle. That way we are getting it at the level we want it. Sometimes if you do not keep all these little housekeeping rules, you will do the wrong thing. You end up giving yourself injection on the wrong place, or if you're not rotating. End up getting what we call the fatty lumps, lipohypoplasm. Which tends to trap your insulin injection and gradually start distributing them. That way it really messes up people's blood sugar levels. People with type 1 might end up having the very diabetes emergency, or those who are totally dependent on insulin will have what you call the diabetes emergency. If you have these fatty lumps trapping your insulin and releasing them gradually, you're no longer in control of your blood sugar. So those are the little housekeeping rules. You might want to always examine the area you're giving yourself injection touch that area to make sure there is nothing. Make sure that when you finish using your injection, you remove the needle from the pen and put in the sharps container. Cover your pen always to protect that area from being contaminated. Pregnant women, during the 3rd trimester, you realize that the skin gets smoked out. It gets a bit harder, stiffer towards the central abdomen. So in that case, we always encourage that you move towards the lateral side of your abdomen to administer your injection. For pediatrics, we do recommend at age 2 to 6 years, we do use 4mm needles but pinch the skin. When they are above 6 years, you can use the 4mm without pinching, just the way you can use in adults. And for the elderly, the healthcare providers, it is the healthcare provider's responsibility to make sure that we assess their cognitive ability to manage insulin injection, make sure their fine dexterity, that is the ability to use their fingers effectively, is good enough. We also need to ensure they know the side effect of insulin and possible hypoglycemia. These assessments need to be made before we encourage the elderly to manage their own insulin injection. Above all, this education goes to the healthcare providers to make sure you provide appropriate education at session using your individualized assessment for everybody, the elderly, the children, know the thickness of the fats and know what to advise them on. Give them proper education because it's actually not quite easy to navigate around insulin administration, especially when they are newly diagnosed. So, having said about this housekeeping, it's time for us to get into business.